Welcome back to Chat SDG, the podcast where we explore the innovative solutions shaping a more sustainable and equitable future. Today, we have the distinct pleasure of conversing with Mr. Ramkumar, IAS, a visionary leader who has spearheaded transformative changes in the healthcare landscape of Meghalaya. Mr. Kumar's dedication to improving public health is evident in initiatives like Mother App, which revolutionized maternal health, and the establishment of Meghalaya Medical Recruitment Board, ensuring access to quality healthcare for all. In this episode, we delve into the guiding philosophy behind these impactful changes, explore the success of innovative approaches like result based financing, and discuss the power of youth centric campaigns in promoting health awareness. Join us as we uncover the unique and inspiring story of health transformation in Meghalaya. Hello, Ramkumar. How are you?
Hi, everyone. I'm good. Thank you. Thanks for having me here. And thanks for generous introduction. But as I said, I'm only a representative of the overall team here, which goes from our Chief Minister, Mr. Conrad Sangma, to the various health ministers we have worked with, our Principal Secretary, and all the colleagues who are working on the ground, even on Saturdays and Sundays.
Ramkumar, as it is often said that necessity is the mother of invention, Meghalaya has been at the forefront of transforming its healthcare landscape, whether it's through the introduction of Mother App or to track pregnant women or reduce the MMR in the state or the formation of Meghalaya Medical Recruitment Board to expedite the recruitment of doctors and nurses. What has been your guiding philosophy behind all these innovations?
So the guiding philosophy for all these things is the purpose of why we have the health department, why there is a public health as a subject. So the public health as a subject exists for citizens to be able to access to quality healthcare and actually have a good quality of life. That starts from way before even birth. It starts from conception or even adolescent health. So saving mother and child, that's a very important point because Meghalaya had a lot of issues in terms of maternal and infant death a few years ago. And we were one of the poorest in the entire country in terms of these numbers. And we were also, the per capita income is also, we are pretty not on the best, not on the top 10 states. So a lot of issues were there. But we took this core issue of saving mother and child as the number one priority. Once with that, all these solutions which we have had of tracking mother, recruitment board, or result-based financing, everything has been started only with the purpose of reducing them and giving quality of life to people. And we have been able to reduce maternal death by more than 50% in the last 4 or 5 years, and infant deaths by over 35% also in the last 4 or 5 years.
Citizens at the heart of interventions you are doing. Meghalaya truly has become the beacon of hope of healthcare reform in India. The Meghalaya health system strengthening project that you mentioned has introduced result based financing, particularly through internal performance agreements. Could you elaborate on how this model is improving healthcare delivery on ground?
Result-based financing is basically how all financing in private probably market works. People are paid based on their results. People are paid by their works. In government structures, we generally tend to put a lot of emphasis on the process more than the outcomes. So we thought in Meghalaya through the health system strengthening project. Of course, this was a World Bank aided project. With the idea came that why don't we look at funding like this? But in Meghalaya, a small precursor to this has been already tried through Meghalaya Health Insurance Scheme, which also gives resources to the health facilities on multiple levels. So what we did here is to combine autonomy of using using the resources at whatever things they think as priority at the medical officer, at the PHC level, district level, and the district hospital level, and the state level, but with accountability. So mixing up with autonomy and with accountability is something which we have tried, and it has paid a lot of good results where people have felt empowered and emboldened and started doing a lot of work. With a lot of colonial institutions and a lot of colonial bureaucracy, or the systems, which government systems we have always had a system of distrust. So we wanted to create a system of trust through this result-based financing. I think we are on the track for it.
Mr. Ramkumar, that's what is so interesting about your initiative. You mentioned autonomy, and that brings to mind youth. Meghalaya has pioneered youth focused health campaigns such as podcasts, reels, songs on critical issues. What was the thought process behind using these unconventional formats to bring an all of society impact?
I mean, it is not an unconventional format. It is probably with the which society is moving towards. It's just that government takes some time to actually adapt to this in a much faster way because governments are not designed in a way to respond immediately to changes in the society. It is designed in a big system where it is making changes for a long term. So during COVID and after that, we found in Meghalaya, it is very difficult to get across information to multiple sectors, um, sects of people who are in different language, different geography, as well as different, urban and rural backgrounds. So then, but technology has come as a big disruptor where people have mobile phones and smartphones and smaller versions so that they can see this quick ads. So we thought of, we were using conventional systems, which we were using even till FM and etc., but it was having very limited reach, which we could see. And then we said, let us collaborate with the already existing social influencers so that through educating them and to collaborating them, we can actually take the message to everyone. And when message comes directly from a government source, some people have, they accept, some people respect, some people have doubts and they have things. When it comes from more already accepted, established people, like the social influencers and others, then there is more openness to listen to it. So that's the reason we've used, and we're very happy that it got a lot of traction in multiple platforms.
And the word is disruption. No one was expecting this disruption from a government department, and as the saying goes, many hands make light work. Your campaigns have gone viral, especially on sensitive issues like teenage pregnancy, some reaching million views. What do you think makes them resonate so deeply with people?
So it's basically the youth themselves are conducting kind of the very young crowd are the ones they themselves doing this podcast and the conversations which are happening. So that is the main connect. As I said, the purpose is the key. When we started the overall mother app or the recruitment board or the result-based financing, the core was how do you address the issues of pregnancy, good health and well-being. When you have purpose in mind, then we are willing to go to the extent which it takes to ensure that this message reaches to everyone. So that's the whole thing. And we want to create that conversation among people because people tend to not have open conversations about teenage pregnancy, be it maternal health, menstrual health, and etc. We wanted to create a whole disruption in that sense, that everything is subject to conversation, and we need to keep the conversations up, alive, and as honest as possible, and scientific as possible.
Absolutely. And, Ramkumar, as they say, rising tide lifts all boats, riding the proverbial digital wave. Please share some examples of the very unique village health councils that you have initiated.
So, Village Health Council is a very important initiative, I think, because healthcare is a very interesting subject. What happened is, over a period of the last, say, 100 years, healthcare has become extremely scientific, which is good. And at the same time, part of it has also distanced itself from the actual public, for which the healthcare is there. So they've been given prescriptions. They are not being given right information or right involvement into the overall healthcare space. It is not everyone's subject. It is still a subject of a doctor or a nurse and with the patient. So it need not be like that. We can talk about it today with finance and etc. Everyone knows a little bit of finance. What is the advantage of using finance, money, stock market, banks, etc. Health also should be something like that. And for various, it was not. During COVID, we struggled a bit because we did not have a health institution at the ground level which will have the confidence of the people and take it, because pandemic management cannot happen by one health system, one doctor, one secretary, one minister. It cannot happen. Everyone's involvement is required. For everyone to be involved, they need to be a little more oriented. So today we are building these institutions to take up healthcare at their own level, solve the issues, and kind of or be in the process of talk about more, create more conversations, and kind of push the systems, demand services, get more services, but also feel involved in the process. That's the most important thing. Unless we make communities involved in the process, when tomorrow something like another pandemic happens, we'll have a lot of distrust in the system rather than trust, so that people are already little acclimatized to the science and the system. That's what we wanted to do through the village health councils. It is the enabling factor in our health systems, which is part of our health policy in the state.
Viewers, inclusive government, and that's an example for you to imbibe. I hope you've been taking notes of the nuanced approach Mr. Ram Kumar has been taking with his department and bringing insights and innovative impactful healthcare initiatives in Meghalaya, from leveraging technology to empowering communities through village health council. Mr. Kumar's leadership has demonstrated that power of holistic and people-centric approach is critical to bring about change. And of course, with his team, as he said, as we conclude, we encourage our listeners to reflect on the importance of innovation, community engagement, and youth empowerment in addressing critical health challenges. As you know, several SDGs are now related to health directly and indirectly. So, thank you, all of you, for joining us today on Chat SDG. Stay tuned for more inspiring conversations on the path to a more sustainable and equitable future. Thank you, Mr. Ramkumar, for this insightful conversation.
Thank you, Mr. Bhavan. As I said, it's very important to have the state leadership to take active involvement in health. Meghalaya spends the maximum in terms of budget for health, thanks to our Chief Minister, Mr. Conrad Sangma, and our Principal Secretary, Mr. Sampath Kumar, the Commissioner, and all the entire team who was there, and each and every health worker and everyone who was involved in this overall process. It is not a 1% effort, it's everyone's effort and everyone's journey together. Thank you.